Hirsch, and I'm doing this video presentation for FSHS 475. That is Intro to Child Life. I am also doing my presentation over Tay Sachs. Many people really do not know what Tay Sachs is. Tay Sachs is a disorder where there's a lack of an enzyme in the body that can kill nerve cells in the brain and also in the spinal cord. Tay Sachs is a very, very rare disease that is most common in infancy. And also, it is a Jewish genetic disorder. This means that it is more likely to be prone if you have a Jewish heritage than any other. A deeper look at what Tay Sachs really is. In our bodies, we depend on the enzyme hexosaminidase A, or also known as Hex-A, and what that does is to break down fatty waste substance in our brain cells. And if this does not happen, it affects the brain and the nervous system. Because there is this lack of the enzyme, there is really, really fast deterioration in someone who is diagnosed with Tay Sachs. There are three main types of Tay Sachs. The first one is the classic infantile Tay Sachs. In this, symptoms normally appear during 3 or 6 months of age. And then the next one is called juvenile Tay Sachs, which this means is that it's most likely to occur in childhood. And those ages that it normally occurs in is between the ages of 2 and 5, but honestly, it could occur during any time of the child's childhood. And the last one is called late onset Tay Sachs, which typically appear in adolescence or early adulthood, but honestly, it could appear at any time in their lifetime. Tay Sachs is a disease that normally affects infants around the age of 3 to 6 months, but it can occur or it can happen to anyone who has 100% of the genes. It just takes time for it to come on. So it can occur at any time in their life. Like I said, there's 3 different types, but it is most common in infants. What is the risk? Infants are the highest people at risk for Tay Sachs. It can affect any children, but they have to receive a gene from both of their parents. So this means is that they have to have 100% of genes in their body, 100% genes of Tay Sachs in their body to be able to get Tay Sachs. Anyone can be a carrier, which is 25%, but they have to be 100% to be able to have Tay Sachs. It also affects the Jewish population more than the normal population. And so, French Canadians, Louisiana Cajuns, and Ashkenazi Jews are 1 in 27 likely to get Tay Sachs. And the general populations, such as like me, I am only 1 in 250 to be able to get Tay Sachs. It is a very uncommon disease, and you have to have 100% of the genes, so genes from both of your parents, to be able to get Tay Sachs. It is really easy to get tested for Tay Sachs, but it is really also important to get tested for Tay Sachs. For Tay Sachs, the only way to get tested is by a blood test, and how you do this is you go to your local doctor to get tested. Even if you have any chance or any thought of maybe having Tay Sachs, it is good to get tested so you know what your children's outcome may be if you happen to want to have children. It is very, very important to get tested for Tay Sachs because Tay Sachs is unfortunately a fatal disease. There are many common symptoms for Tay Sachs, but the main one that people notice is they begin to lose their developmental skills. And what this is saying is that children, when they are young, they develop stuff really fast. So it goes in like a common pattern. So they sit up, they start to roll, or they roll. They sit up, then they roll, then they crawl, then they walk. It normally happens at about at that area. But around the 3 or 6 age months, it starts to decline, and so they won't be able to do this, and you'll see a backwards progression of developmental skills. They also lose their motor skills, which can lead to they cannot speak properly. They also have issues swallowing, so that they may not be able to eat out of a bottle, off of a spoon. They may have to get a feeding tube. They also get stuff as like muscle cramps. They also have vision and hearing loss, and they can also become paralyzed because of Tay Sachs. The average life expectancy of a kid with Tay Sachs is about 2 to 4 years. This is because there's such rapid deterioration from Tay Sachs that the body cannot handle the lack of the enzyme, and so it cannot regain any of it. So Tay Sachs is unfortunately a fatal disease. As of right now, there is no cure for Tay Sachs. There is also no effective treatment for Tay Sachs. The only thing that people, like parents and child life specialists, can do for a child with Tay Sachs is to comfort them. This is really important because this is a really hard and complex disease to understand, and you may not know you even have it, and so you need to make sure you give them comfort and support so they are happy in that they are enjoying the last couple of years of their life, because Tay Sachs, as I said before, is unfortunately a fatal disease. Like I said before, the outcome of Tay Sachs is a fatal disease. There is no cure, no treatments that have helped. The age group that I chose is an age group of 5 and under. The reason why I chose to do this age group is because children or infants who are normally diagnosed with Tay Sachs, they normally do not live above the age of 5. Like I said before, their life expectancy is only 2 to 4 years after they're diagnosed because of such a rapid deterioration. According to Piaget and Erickson, there is these are the two main theorists that have talked about child stages. And the Erickson trust versus mistrust, and that is the parent is the most important person in the child's life, and so they need to be there for their child. This is really important, and if a child has Tay Sachs, because they may die soon, and they may not be able to spend that much more time with their mother. So it's good to get that interaction and know that their mother is there to comfort them. They also need to be given their basic needs. This can be by the hospital, this can be by their parents. And so this is really important for Tay Sachs because with children with Tay Sachs, because they might not be able to do that for themselves. Also, in autonomy, it is really important to try and do things independently, but this is really hard for children with Tay Sachs because they lose their motor skills, so they may not be able to do many things by themselves, so they may have to get help with many things. In the initiative versus guilt, you need to have a good imagination, and this is where Erickson thinks that imagination expands. And so, it is really important to try and help the kid out in many ways possible and help them play games so they have an effective imagination. According to Piaget, a kid 5 and under is in a sensory motor or pre-operational stage. In the sensory motor stage, it is really important for kids to discover things through their senses, such as taste, touch, sight, hearing. This is really hard for kids with Tay Sachs. Like I said before, they lose their motor functions and they may not be able to touch. So it's really important to give them toys or something that can help with holding something because of their coordination. And then also in the pre-operational stages, it is also important that they get at least some symbolic play, so they have time to play. It is very important that kids develop even if they have a fatal disease. There are many issues related to hospitalization. The first one is physical development. There's a lot of things. It can be really scary for kids any age in the hospital. The first few things I think it's important for people to realize the issues during hospitalization is that kids feel like they have lost the control. This is very common because there's many people around them that they don't know, and it's really hard for them to understand. It is also really hard for them to visually see because there's so many weird things around them and they're not in the normal space. Also, children are in really unusual routines to what they normally are, and so it's really hard for them to cope. In the cognitive side, they hear a lot of unfamiliar voices, and they also have like many caregivers that care for them, so it's very hard for them to cope, and it's really hard, and so they may cry and they may not cry. And in the social and emotional side, a lot of kids get a lot of separation anxiety from being away from their parents for a long period of time, and also from having many caregivers. This is really hard for kids, especially with Tay Sachs, because they really want their parents to be there, especially since they may not have that long enough to live, and they may or may not know that, and so it's really important to have that interaction. So next I'm going to talk about how people can help, like the interventions for these. So for the physical, the first thing is you need to make sure that each child has a really, really safe environment. This is really important for any kids with any disease. The next thing you can do is have appropriate toys. This is really important for a kid with Tay Sachs, just in case they lose their motor functions, then like in their hands, and they can practice with their toys to like maybe regain some of that or keep it there longer. It is also good to have standard routines with the parents, and so this could be like scheduled interactions. So like the kid does not get off any schedule. You need to make sure that you're on a consistent schedule because it can help a kid better in a hospital. The next, with the cognitive side, you need to make sure that you use simple terms and directions to help with the kid. This is really important because a kid's imagination can get really big, and they can think of many things. And so this goes with Tay Sachs is because a kid with Tay Sachs may lose their hearing. And so you need to make sure you use short sentences and talk really clearly to make sure that they understand. You also need to make sure that you give them their undivided attention because they may get really frustrated if not. With the social and emotional development, you need to make sure that there's a lot of parent interaction with them, like the parent-child interaction, and you need to make sure that they have their private time. This is really important for a child's development, even if they have a fatal disease, to make sure that they have someone there and they are not alone. This is highly important for a kid who's in a hospital for a long time. The role of the child life specialist is to make sure the child is comfortable. As well as making the child comfortable, it is also important that child life specialists are there for the family. This is really important because this is a very uncommon disease, and it is fatal and is really hard to understand. It is important that the child life specialist is there to answer questions for the family, for the child, and to also help them make any arrangements that would be possible. Another way a child life specialist can be there is to explain the disease using visual aids. This can be used from stuff that's like within the hospital, but it's very important that the child life specialist is there to help the family feel more comfortable. She can do this by watching the child so the parents can go out and do something instead of staying in the hospital. A child life specialist can also help them make decisions and also like inform them about different decisions, and then they can also make arrangements. This could be like to talk to a funeral director so that it can make them feel more comfortable. That can also get the child involved with that. And so a child life specialist for a family with Tay Sachs is to just pretty much help them understand the disease and to support them through the decisions that they have to make. It is a very complex disease, so I think a child life specialist is needed because it's such a hard disease to understand. To explain the disease Tay Sachs, I would use many books and many visual aids to talk about Tay Sachs. The reason why I would do this is because Tay Sachs is a very complex disease that is very hard to understand. And I think that these would be most effective for the fact that since it is such a complex disease and is hard to understand, then I would be able to break it down and explain it to a child and even to family members. I have also included a list of resources that I believe would help people understand about Tay Sachs. I think that these websites are very good. I learned about Tay Sachs very much myself from these websites, and they are very good resources to use to learn about Tay Sachs. Overall, Tay Sachs is a very unfortunate disease, and it's very hard to understand. but unfortunately it is a fatal disease. I have learned a lot about Tay Sachs, and I think that it is good to know about, especially you know your risk of having Tay Sachs, so you need to go get blood tested. Overall, Tay Sachs is a fatal disease, and you just need to be there for the family to make sure that they understand about the disease. Thank you.